All right, welcome to Life Extension Live. I'm Dr. Mike, and that is
Dr. Crystal.
So we're going to be talking about your liver today. Everybody knows it's important for detoxification, but it's actually involved in hundreds of other types of essential reactions in the body. But here's the thing, 1 in 4 Americans have something called fatty liver today. It is the most common chronic liver disorder that we know of right now. So this is something affecting a lot of people. So on today's show, we're going to talk about what causes fatty liver. We're going to talk about ways to test for it and then nutrients to help restore liver health. So, Dr. Crystal, this is 1 in 4 Americans have struggling livers.
And what surprises me is no one knows about it, one, and people are often trying to do these liver cleanses and these liver flushes, and everybody's on the next detox diet wave. So they kind of know the liver's important. They know for some reason they kind of need to focus on the liver, but they're not focusing in on this.
Right. So fatty liver, it's just as the name sounds. It's fat. Fat is accumulating, building up within your liver cells.
Yeah.
And it's just clogging them up. It's making it hard for them to do their jobs. That's essentially what's going on.
Yeah, and you wanted to bring out that it's not necessarily fat from the diet.
Right. You have to understand that, although that plays a role.
Yes.
Without a doubt. And we're going to get into all this, like what causes it and stuff like that. But this is a growing issue because it can get a little worse if not taken care of, right? So what we're talking about initially, when I say 1 in 4 Americans have fatty liver, most of that is known as non-alcoholic fatty liver disease, right?
Yes.
So we're not talking about alcohol here. We're talking about developing a fatty liver outside of alcohol because ultimately of how we eat and how we live.
Yeah, it's really a disease of metabolic dysfunction. And so you'll see some different variations in the terminology. But yes, it's due to the excess fructose in our diet.
Yep.
That, to me, that's the main culprit. The high fructose corn syrup and the fact that there's fructose in everything that we eat. And that fructose is being stored as fat in the liver.
Yeah, that was the whole point. It's not just the fat that you're eating, right? It's the sugars. It's really the sad American diet. You put all that together, that leads to fatty liver. So let's just clear up the names. Make sure we're clear on this. We're going to refer to this throughout the show as non-alcoholic fatty liver disease. But I'm going to read them the name change.
Okay.
It was actually changed recently in all the medical, professionals out there. They decided to change it. It's now called metabolic dysfunction associated steatotic liver disease, or MASLD. We're just going to call it fatty liver.
That's it. Right.
We're just going to keep it simple. We're going to call it fatty liver. It can advance. And that's really why we're talking about this.
Yeah.
It can lead, matter of fact, I think we have a graphic for this, right?
We do.
You can see on this graphic the change over time from a healthy liver to a fatty liver, all the way down to even cirrhosis. And that's end-stage liver disease.
Right, and that is not reversible.
That's at that point.
So if the whole idea is to prevent this from progressing to some of those more advanced stages where, there's not much that you can do about it. And the worst case scenario, and we do see this now, that liver cancer rates are increasing due to the fatty liver that is either diagnosed too late, and now you're having symptoms, because we'll talk about this. There are no symptoms.
That's one of the things about it. It makes it tough, right?
And so you are diagnosed when it's more advanced. And so we are trying to encourage you and let you know, hey, this is something that many people are walking around dealing with.
And not even knowing it.
75% of people in the U.S.
Not even
dealing
knowing
with the fatty liver.
But the good news is there's stuff we can do about it in those early stages.
Right.
It is reversible.
That's right.
At the end of the day. So let's really focus a lot on that. But before we do, what causes fatty liver? I mean, let's first talk about the metabolic syndrome.
Right. That is by far the risk factor.
Right.
So metabolic syndrome, that's overweight, obesity. And I know people don't like to kind of use that language, but it's a part of the criteria. If you are obese, there is a 70% chance of fatty liver.
Right.
All right. Metabolic syndrome, elevated blood sugar. There is the elevated triglycerides with low HDL, elevated blood pressure,
Yeah,
and increased waist circumference.
Right. I knew you were going to get that blood pressure.
Yeah.
It was stuck on your tongue. Yeah. So those are the parts of metabolic syndrome, and unfortunately, lots of people are walking around with this stuff.
Right.
Right, and that's really where you're going to get fatty liver. There are microbiome changes to all this. It seems like we keep coming back to the microbiome a lot now.
Well,
isn't it?
they're going to have to watch our gut health show.
Yeah, we just did a whole gut health show on this. But overuse of antibiotics, honestly, overuse a lot of your over-the-counter pain relievers like your aspirins, your ibuprofens, all of that is having an effect on the microbiome. And we now know the microbiome has a connection to the liver.
Yes, that microbiome, when you have this dysbiosis, then that can lead to intestinal permeability. When that happens, you have some pathogenic bacteria, some of their byproducts that's now going straight to the liver. Because remember, the gut, your digestive tract or the small intestines, goes straight to the liver. Contents that you eat go to the liver first.
That first pass effect.
Yes, and
is
then
what it's
that
called.
leaky
Yeah.
gut, you're getting things that's now going to the liver that normally would be that gut barrier
Right.
would keep in the gut.
So again, we're going to talk about, because one of the questions people ask a lot is, well, how do I know? Like, how do I know I'm struggling here? How do I know my liver is struggling? What are those symptoms? Well, that's the problem. In most cases, it's like blood pressure. It's silent.
It's the silent epidemic.
Yeah, that's right. That's what we're calling it, the silent epidemic. Now, there is some new research that is showing fatigue might be an earlier sign of fatty liver, but of course that's so vague.
Yeah.
It's hard to know. So if you're feeling fatigued and tired and you've gone through all kinds of different maybe treatments for that and nothing's working,
Yeah.
maybe it's time to check the liver. But for the most part, there's nothing.
There's nothing, but there are obviously, most people have a routine CBC chemistry test, your lipids, that's tested yearly with your general practitioner. And that can give you a clue, because most of those labs, they will test your liver enzymes. And the liver enzymes, that's a sign that liver tissue, those liver cells are breaking down.
Right.
And when you see the elevated enzymes, then that's a clue that something's going on. When you couple that to some of those metabolic syndrome risk factors, if you have diabetes, or if you are diabetic, you are dealing with obesity, and you have an elevated liver enzyme ALT, there's a 97% chance that you have fatty liver.
Right. And so your doctor is going to be able to look at the whole picture, right?
Right.
They're going to look at your risk factors for metabolic syndrome. They're going to draw your blood, check out your liver function. And even at some point, I don't know, I think we are going to talk about that, ultrasound can even actually help to diagnose that. Now, you have your doctor, let them do their job. They're going to want to rule out some stuff, right? They're going to, when they see all this, they are going to ask you about your alcohol drinking. That's just normal. But again, we're talking about non-alcoholic fatty disease. So if you're following the basic recommendations for alcohol, which is a couple drinks a day, basically, let's keep it simple, you're probably okay, right? They're gonna want to look at, is this a virus? The hepatitis viruses. Could this be autoimmune disease? And there's even some rare ones down the line.
Here you're talking about just if you have elevated liver enzymes on a lab.
They're going to want to rule out a bunch of this other stuff before they're going to say, oh, yeah, this is just non-alcoholic fatty liver disease. So just be prepared for that when you're at your doctor's. But then, the ultimate diagnosis for this is going to be an ultrasound and a biopsy. They're going to take a little piece, and they're going to look at it, and they're going to go, fat.
Yes. But before you get to that point, and if this is something that you're thinking, oh goodness, I have some of those risk factors. Do I have fatty liver? Ask your doctor. They can plug in some of your some of these risk factors into this little algorithm that can give you a score,
Right.
which will, before you get to the biopsy, don't let the doctor do that first.
I'll tell you, they won't. And as a matter of fact, in many cases, if everything comes together, you get a high score for this. You got those metabolic risk factors. You have some elevated, and a radiologist can see. You can actually see a fatty liver.
With the ultrasound.
They're not doing that many biopsies.
Yeah.
So but we have to give you the information. That is the gold standard. Would be ultrasound biopsy, but you probably won't get to that stage.
Yeah.
There's no need for it. As a matter of fact, most doctors, and this is my approach, Dr. Crystal, would be, all right, I think this is fatty liver. Let's work on it. And then let's repeat some of this stuff and let's see if it's working.
Yep.
That's really the most important thing. And so I'm actually, I think I have some pictures of a fatty liver on ultrasound. So we can show that. So you'll see a normal one, and then you'll see a fatty liver. And you can see the difference in texture and what it looks like under ultrasound.
And you tell me which one looks like a liver that's functioning
Right.
at peak performance.
And one that's a little clunkish.
And just think about the role of the liver. I like to focus on the liver for detox. I think that motivates a lot of people to say, hey, I think I should not have a fatty liver because I need my liver detoxing everything that it's encountering from the outside world.
But here is the good news. So a lot of people are asking, okay, does it go away? What can I do about it? And the answer is it can go away. It's one of the most, the liver is one of the most impressive organs. It is resilient. It can take a hit, but it wants to repair. It wants to get rid of that fat. And the good news is it can go away. We just want some pretty simple changes.
Very simple lifestyle changes.
So let's get into that. Let's get into what you can do if you have been diagnosed with non-alcoholic fatty liver disease or you're suspecting it, what have you. Let's first talk about diet.
Yeah, what should you be eating? All roads lead for me to the Mediterranean diet by far.
100%.
It's the diet
Me
that
too.
shows
Why would you say
to
for
help
me?
with. Well, because I know you like the DASH diet, and we're going to talk about DASH.
But I know
You always talk about DASH.
The Mediterranean's at the top of the list for me too.
But there's a study, a randomized controlled trial, 294 obese participants with abnormal lipid levels, including 182 of those people have this non-alcoholic fatty liver disease. They were randomly assigned to a healthy diet, Mediterranean diet, or Mediterranean diet that included extra polyphenols. After about 18 months, those in the Mediterranean diet group lost 2 to 3 more times liver fat than those in the healthy diet group.
2 to 3 times more.
Yes.
That's impressive. So that's the power of the Mediterranean diet.
Right, compared to a healthy diet, and that's what I like.
I know that's what's so the control is healthy people eating healthy food, and the Mediterranean one.
Yes.
I like the Mediterranean. You're right. I do
Now,
like the
but you do talk about DASH diet, so I wanted to make sure we focused in, and I found some research on the DASH diet as well.
Dietary approach to stop hypertension. I always like to remind people it's basically less sodium, more calcium, more magnesium, more potassium.
Yeah.
It's kind of the Mediterranean diet.
Kind of, sort of is.
Come on. It's close. It's close. What did they show for the DASH
So
diet?
yes, and this was a 12-week randomized study showed greater reductions in liver fat and fibrosis, Dr. Michael. We haven't talked about
A little
fibrosis.
bit. That's getting at that end stage.
Those liver enzymes among participants who received a DASH diet and compared to a control group that were given a reduced calorie diet. So what we're learning here is not just about reducing your calories. Some people reduce calories and they're just cutting out one donut, but they're still consuming high fructose corn syrup, processed
It has to be more
foods.
of a change in
It
that,
has to be more of a diet that's going to help with more of those metabolic changes.
Right, and another approach too is fasting. I know we don't have as much research on that, but we know there have been claims like intermittent fasting maybe for a day maybe a couple times a week, stuff like that may also help a little bit.
Well, what fasting will help to do is to reduce the overall calories in your diet. So whether you choose one day or you choose 2 days or you choose the intermittent days, ultimately you're trying to reduce the amount of calories that you're taking in over, let's say, that week's period. And that's one of the strategies that your doctor or even your nutritionist will tell you if you're dealing with fatty liver. Let's try to maybe cut back about 500 calories per week. And the goal is to try to get the weight down, really try to manage that visceral fat. And that will start helping you as you're losing that weight, you're losing that fat from the liver.
So there's some dietary approaches that you can try. Let's get into some nutrients for people. At the top of the list, I think, is milk thistle. And it has that compound in it called silymarin. So you want to make sure your milk thistle is standardized to the silymarin. And that has some pretty powerful effects in the liver as well.
Yes, and so there's a study with NASH patients. So these NASH patients, these are individuals with fatty liver, but this fatty liver is now inflamed.
It's a little worse.
Maybe there's some fibrosis there. And so in these patients, a study with 700 milligrams of silymarin 3 times a day, 22.4% of liver biopsies showed reduced fibrosis versus 6% in the placebo group. So we are seeing that silymarin or that milk thistle can help to reduce that fibrosis in the liver.
I think that's pretty impressive. You know I like milk thistle. And out of all those like liver detox programs that are out there, I think the one that is safe to do every day, it's a mild detox, is milk thistle.
Okay.
I'm sticking to that.
So every day, just in general.
Every day you take milk thistle, just as a general liver supplement.
You guys, I'm like staring at Dr. Mike in shock.
What?
Because I thought you were going to say NAC, which we're going to talk about NAC. Every day, N-acetylcysteine. So he went to milk thistle.
Wait. NAC is an everyday one too, but I'm talking specifically about liver here. Okay. So NAC is an everyday one for other reasons.
Okay.
Plus liver. Milk thistle is your daily liver cleanse.
All right. He throws me off sometimes.
No, come on.
And then you get the real reaction on the live show as I'm staring at him saying like.
All right, let's move on to number 2.
Probiotics and prebiotics.
Yep. This is, we come back to this so often, right? I love it. We already talked about how fatty liver can disrupt the microbiome. You get more of a leaky gut. A lot of that gets right to the liver. It just causes more problems. It's going to help advance the fatty liver to that NASH stage, more inflammation. And so obviously, wanting to restore a healthy microbiome makes sense.
Well, you're trying to restore that balance. And we know that there is the beautiful relationship between probiotics and prebiotics, right? The prebiotics, they are feeding those bacteria that you're delivering. And so sometimes you see in research they're combined, the probiotic with the prebiotic given together. It's kind of like you're giving the food and giving them some resources to live.
Makes sense. Yeah, it makes sense.
And there's some good research with liver health.
Yeah. So on one hand we have a meta-analysis of 9 randomized trials. Remember when you pull clinical trials together, you get more data in a sense. You get more people involved, and it helps you to maybe have more confidence in some of those individual results, right? So a meta-analysis, very common, 9 studies put together, a total of 352 subjects with fatty liver, and they found probiotic therapy reduced liver enzyme and total cholesterol levels.
Nice.
I mean, look at
probiotics. And then we have a study with the combination. We call this symbiotics. That's when you combine the probiotics with the prebiotics. 52 overweight or obese individuals with NAFLD, the fatty liver, In this preparation, there was a combination of 7 bacteria as well as 125 milligrams of that prebiotic in the form of FOS. We talked about that last week on our gut health show. Fructo oligosaccharide.
Hey,
it's a type of carbohydrate that's a prebiotic. And this was a 28-week study. And we saw that group with the combination, greater reduction in those liver enzymes. Again, that's the marker that the liver is, those cells are breaking down.
Inflammatory markers came down as well. And ultrasound measured fibrosis came down versus placebo.
Yes, with that combination. So these are simple things.
Yeah.
Restoring balance in the gut.
Again, a lot of this stuff really comes back to foundational, nutrients for us, right? By the way, that study was published in the American Journal of Clinical Nutrition in 2014. Now let's talk about NAC, another daily nutrient. Yes, NAC's one of my daily ones for sure.
Okay.
NAC, N-acetylcysteine, for those of you who don't know, is a precursor to glutathione. And it just so happens glutathione is the liver's favorite antioxidant.
Well, it's the universal, antioxidant.
And the liver loves it, though. The liver just lives off glutathione. Glutathione. So let's talk about NAC in the trial.
We have a research and a clinical trial in 30 participants with NAFLD. Those who received 600 milligrams of NAC twice daily.
You yell at me. NAC!
Had a greater reductions in levels of ALT liver enzymes than those given 1,000 milligrams of vitamin C twice daily after 3 months. NAC therapy also led to decreased spleen size, which may indicate reduced fat infiltration. So this NAC in this study, the NAC was compared to vitamin C. And again, that was 600 milligrams twice daily, 1,200 milligrams total.
Yeah. Another study looked at NAC alone, right? Just NAC by itself versus no treatment. Same basic results. Only after 4 weeks, drop in liver enzymes in those receiving NAC versus no treatment at all. Yeah. So N-acetylcysteine, I love it.
Okay.
I take it every day along with milk thistle. I want all my organs to do good.
Nutritionist approved.
Thank you. So I got heart stuff, I got brain stuff, prostate stuff.
And you got your milk thistle.
Liver stuff. Goes on and on and on. There's a bonus nutrient.
CoQ10.
Yeah, this was some recent research, right?
Well, we do know that people are just asking about CoQ10, and people typically think about CoQ10 for the heart. So we wanted to kind of highlight and spotlight that there is some research with CoQ10.
I mean, listen, CoQ10 is needed by all cells. It's part of your energy production cycle. If you can't make energy, things get sluggish. Fat cells accumulate, right? So it makes sense when you think about it.
Yes.
What was it, like 100 milligrams a day?
100 milligrams of CoQ10 found to lower liver enzyme levels, markers of inflammation, reduce NAFLD grade, kind of that grade based on ultrasound assessments, and improved metabolic hormone levels in just 12 weeks. And so that's 100 milligrams of CoQ10.
So if you're listening to this and you just heard the different diets, you just heard the different nutrients, sometimes people want a little more help. Like, what do I do? Where am I going to go? I think Mediterranean diet would be the one to follow, right?
Okay. Over DASH.
I am. I don't know what I do like DASH, but Mediterranean's the top of my list. And I think, honestly, and the probiotics for sure. And if you want to throw some prebiotics, go for it, right? Those two for sure. And then I would probably, is it milk or NAC if I had to help someone? Both. Just do it. How would you choose? That would be hard.
I know. It's very difficult to choose. It would all depend on if you have NAFLD or MASLD.
Wait.
Or if it has progressed to MASH or the more advanced stage. You need both. You need both, or zero in on that milk thistle.
Yeah.
And that was, I think that one study, 700 milligrams 3 times a day.
Okay. Whew! That was a lot. And then there's more breaking news.
Yes.
Yeah, now it's kind of weird because, you have to be a little, well, let me just say what the breaking news is. It's aspirin.
Baby aspirin.
Baby
right?
aspirin. Which makes me feel better because the larger adult aspirin can cause problems. But a baby aspirin has been recently shown in the Journal of the American Medical Association to help out with fatty liver. A little baby aspirin every day.
Who knew?
We do.
Make sure it's enteric coated.
Yeah,
to protect the
for
stomach.
sure. Yeah, for sure. Enteric coated. So let's just back it up real quick. Fatty liver, 1 in 4 Americans.
75% of people in the U.S.
And if not taken care of, it can progress. And it can progress to pretty bad stages of liver function.
Well, we're seeing that it's up there. I think the number 2 cause of liver transplants.
See, it's all
So it's happening
Yeah.
because it's the silent epidemic.
silent epidemic. So make sure have a conversation with your doctor about this.
would.
If you have some of those risk factors in the metabolic syndrome, maybe you've already noticed because you do annual lab testing that your doctor said, your liver enzymes are a little up, but not so much that they were that concerned, but a little high. I mean, maybe it's time to really sit down and talk about fatty liver. Maybe finally get that ultrasound.
Yeah.
Right? But good news, don't forget, it's all reversible with diet and good nutrition. Woo! That's a lot. If you want to learn even more, right, you go to lifeextension.com/fattyliver. That's a protocol that Life Extension has put together. You think this was a lot. Those protocols are fantastic. They go through so much of the research. In these shows, we're just touching on little
Sprinkles,
points.
yeah.
Little sprinkling here and there. The protocol is really where you can dive in. You can share that information with your doctor.
You can. I would print it or email it, share it with the doctor. The studies that we're going over, many of them are in the protocol, so you can find the references.
It's all there.
And it's all there.
Lifeextension.com/fattyliver. And then while you're there, you can shop around and use the discount code LELIVE for 10% off $50 or more, plus free shipping and handling. That's all at lifeextension.com/fatty liver. And don't forget, we go live every Wednesday.
12 noon.
12 noon Eastern time. If you watch us on Facebook, click interested. If you watch us on YouTube and Twitter, go ahead and follow so you never miss a show. We go live every Wednesday, 12 noon Eastern time. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for watching, and we'll see you next time.